Hello, everyone. Greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure you all must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is a very common on your skin or your nails. Fungal infection or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Akshita Anand, live from Ghaziabad, to enlighten us on the topic of on-fungal infection. Dr. Akshita Anand is a dermatologist and an aesthetic physician with a great clinical acumen and diagnostic skills. She completed her MBBS and post-graduation MD from Swami Vivekanand Subharati University and also has attained a fellowship in aesthetic medicine. She is also an accredited member of the IADVL, which stands for Indian Association of Dermatology, Venereology, and Leprosy. She has over 6 years of accomplished experience in managing various skin disorders, acne, pigmentary skin disorders, hair loss, and facial aesthetic enhancing procedures using the most advanced technology. Today, Dr. Akshita Anand will share with us on fungal infection. Hello, ma'am, and we welcome you to this platform. With that, our first question for you today would be, what is fungal infection?
So fungal infection, as generally people say it as a rash, it happens in the most humid weather, and
Right.
mostly the affected areas are the folds of our skin, like our axilla or the groin area, wherever there is fold. That would be the most common site of predilection. And these are like a patch of reddish patch which is itchy, and it might spread to a larger area if kept untreated.
Right. Now that we know what fungal infection is, ma'am, our next question for you would be how to take care of fungal infection and how to tackle with the same.
So, firstly, it would be how to prevent it. So, we have to wear loose fitted cotton clothing so that the sweat is absorbed. It's not over the surface, and there is no lot, we can avoid that friction due to tight clothing. Secondly, if there is some itchiness or some rash, then we should keep that area dry, especially the groin area, because that's the most sweaty and you can say the most enclosed area. So, first is wearing cotton clothing. Second, it would be dry that area effectively after whenever a person uses the washroom. And then you have to keep your clothes dry. You shouldn't wear moist clothes. You should iron it properly and make it completely dry before wearing it, even the undergarments. You should regularly take bath, and drying out your skin is very important. Then people who uses gym and do workouts, they should take bath immediately after the workout and dry that area as well, so that incidence of fungal infection decreases. And then if you have that itching or that redness, again coming to the same thing, keep that area dry. Secondly, use antifungal over the counter powders. And if you have developed those things for a longer period of time, then it's best to get consulted by a dermatologist. You should not use over the counter medications, because these medications like ring guard and itch guard, because this will eventually make it more worse. So you should avoid these medications. You should avoid self-medication, and you should always consult a dermatologist who can recommend you the best treatment possible for you.
Well, audience, as best guided by our doctor today is that please visit your nearest expert whenever you're having such problem. And of course, we are here today to reach out to you and to bring out the easiest solution to fungal infection, which is now a very common disease. Ma'am, about fungal infection, what can be the treatments of fungal infection for all those people, for all those audience who are watching us, who are already suffering from fungal infection? If they want to ask you this question, what can be the treatment for fungal infection?
See, every person is different. Every person extent of infection is different. So there's no like fit all treatment for every person. Every person you have to give a customized or a treatment for the type of infection they are having. Mostly the fungal rash can be of two types, which is very superficial. One involves the upper area of your trunk and one is in the folds. So both of these are different and you need to use different kind of medications for both of them. But still in summers, again, other than prevention, I could suggest using an antifungal soap for bathing, cleaning your skin properly. No usage of the loofahs or scrubs because they're always wet and kept in the washroom, and that is again a source of yeast and mold. So you should avoid using these scrubs and loofahs. You can use antifungal powders because this will again help you in absorbing that extra moisture, and again avoiding friction due to tight clothing. But again, it depends on person to person, like what oral medication or topical medication should be given. Oral medication again depends on the extent, it depends on the age of the patient, and there are multiple factors to it. So there is no generalized rule I can say you eat this medication and you'll be fine,
Right,
because the
right.
treatment can go up to maybe 1 or 1.5 month also.
Mhm.
Because people generally self-medicate themselves with steroid creams and everything, which further worsen the infection. And when the patient reaches to us, they have that florid kind of infection covering almost 50% of the body surface area. So the extent of treatment would be different for them. So, in my opinion, you can always use a antifungal powder and soaps to prevent. And if there is mild infection, you can use that. But it's always better to consult properly so that your treatment can be completed on time with best results.
Right, ma'am. Ma'am, now that we are talking about the treatment of fungal infection, what are the antibiotics which are usually used to treat fungal infection? What are the
Antibiotics,
most common antibiotics?
antibiotics has no role in fungal infection. Antibiotics is just given by, I don't know, maybe it's taken over the counter, but antibiotic has no role to play when it comes to fungal infection or rashes or tinea, as we say, or ringworms. It has no role. So you should definitely avoid any kind of antibiotic. It has no role to play in the treatment of a fungal infection.
Well, audience, I think for all the viewers who are watching us right now, this is something we need to make a note on. Please, please do not use whatsoever you get to listen to, or if anyone suggests, don't go for that. Please consult your nearest expert. With that, we'll be moving on to the next question. Our next question is, which is the most serious fungal infection?
See, whenever we talk about skin, the most common would be the ringworm or the thing we say rash ho gaya, fungal rash. That is the ringworm. It's serious. It's not nothing serious about it, but it is serious because it it's very discomforting. You have that itching sort of a thing an entire day, and it's very discomforting for you. Again, the superficial fungal infection, as there are hypopigmented patches over the skin. That is also a kind of fungal infection. Again, it's nothing serious about it, but obviously it involves your upper part of the body, so you need to treat it. And if you actually want to ask which is the most serious kind of infection, then that is the deep fungal infection, which is not very common, but definitely there are cases in which you get those patients. But that definitely needs a dermatologist opinion, because we have to examine a patient and investigate the patient and then start treatment.
Right. Ma'am, because we are talking about the seriousness of fungal infection, I think women nowadays, as I am getting to see from a lot of friends these days, a lot of them who are, frequently traveling, they are very much suffering from fungal infection. May it might be possible because of the frequent use of public toilets. Also, it can be of not maintaining better hygiene. Ma'am, how further can this go? I think our audience would want to know this.
When we talk about female having these issues, I think whenever menstruating female would the frequency will increase because of regular friction with the pad applied there. So that will increase the incidence of fungal infection. Again, whenever a female uses a washroom, the groin area gets wet easily. So if you're not drying out that area regularly with a tissue or something, then the chances of infection will increase. Again, because of, as you said, when female are traveling, because when you're traveling, uh, considering that you're wearing, trousers or something, just tight fitted. So that friction would again, sweat will increase, and that will again increase the incidence of fungal infection. It has no gender role to play, like male, female are equally affected, but definitely females, you can say, because one issue could be this menstruation thing and using the washroom, the incidence might be higher. But generally speaking, this infection does not, is separated by this.
Right. Ma'am, is fungal infection contagious? Can it spread from one person to another?
Yes.
What are the
So
means?
it is definitely contagious, because if someone, as I told you, 40 to 50% of body surface area might also be get involved. So when clothes are washed together of the entire family, they can, spread that infection, because fungus spreads like bread baby fungus lagega, so it will
Right.
spread. So
Right.
that is how it works. And the other fungal infection is, in females, it's very common to have, whitish discharge, vaginal discharge. So that is again candidial fungal infection. So sexual intercourse is also one thing which increases it. Even the males get that candida infection. But again, the organism is different. If it is, due to discharge, the organism is different. If it's on the skin, upper body, the organism is different. So this is how it is. There's no generalizing, but it is contagious, definitely.
Ma'am, apart from spreading from one person to another, can few products also lead to fungal infection at times?
No, actually, these fungal spores, specifically which infect human body, cannot survive on the fomite, and the fungal spores which are on the fomites will not infect human body. They need specific things for their nutrition, so there is no cross contamination among the product.
Ma'am, but speaking of another product, or I don't know, it is very frequently used by girls these days. They are very casual about it. Ma'am, what about contraceptive pills?
Contraceptive pills has no role to play when it comes to fungal infection. Again, contraceptive pills is something orally taken. It has nothing to do with, the superficial fungal infection. There is no role.
Right, right. Well, I think we are clearing out a lot of doubts today, and I believe our audience, they are thoroughly enjoying this session with our doctor in house. Ma'am, moving ahead, we have another question for you, ma'am. This is a usual question which arises again and again, because the thing arises again and again. Why does fungal infection keep on occurring again and again, even after treatment?
Because mostly the patient here takes the treatment till the time they have that discomfort. Firstly, the itching will go, but it's not necessary the infection is cured. And people stop their treatment in between. That up to ठीक हो गया, कोई problem नहीं है. But when the fungal spores are still there, say it's only 10% left of what it was, but that 10% would again reach up to that 100% if you don't treat that. So I would say it's inadequate treatment, which causes to multiple, you can say, this thing, multiple episodes of recurrent infection. It's inadequate treatment.
Ma'am, because we are talking about the reoccurrence of fungal infection again and again, even after treatment. Ma'am, what does our diet has to do in such? Does our diet plays a very important role in this?
Not directly, but indirectly, because every kind of infection, if a person is diabetic and sugar is uncontrolled, so any kind of infection will be more severe, and it will take more time to go. So same is with the fungal infection. If a diabetic person is not taking care of the diet and has uncontrolled diabetes, the fungal infection will go on for a longer time. It
Right.
will be recurrent. So that is indirectly it's related, but nothing in diet would directly, affect your fungal infection, because it's superficial on skin.
Right. Ma'am, does our immunity play some role in fungal infection as well?
Definitely, to certain extent, it will curtail the infection to that limited part if your immunity is good. But in patients who are immunocompromised or have some diseases, or are immunocompromised, then the infection would be widespread. So yeah, that would be one thing of a concern. immunity plays a role there.
Ma'am, speaking of immunity, does fungal infection, is there any thing we should usually avoid in taking, suppose food, in the matter of food? Do we have anything? Nothing as such. For the people who are allergic to few items, is it safe to consume those items?
If one is allergic to some particular thing, like many people are allergic to Chinese, some random
Right,
thing, anything,
right,
corns or something, then they'll be allergic to that particular thing for life. You can't
right.
change that allergic thing. But
Mhm.
it's not specific to fungal infection. They'll be allergic in a way that they might develop hives or something like that. But fungal infection is not related to that.
Okay. Ma'am, moving ahead, our next question for you would be, can I stop taking antifungal treatment if symptoms get better earlier? I think this is something which we have already talked about. Would you like to put some light into it as well?
Again, I think your dermatologist is the best judge to tell you when to stop and taper the medication. It's never
Right.
advisable to stop medication in between. There has to be a tapering dose, and then you tell the patient to go on a maintenance, because otherwise if you do it inadequate treatment, it will be recurrent again.
Ma'am, speaking of this, we have another question for you, also a concern for all the audience, for few of the audience who are watching us. Can oral antifungal drugs be taken during pregnancy?
There are separate kind of drugs which is given for pregnancy. Normally, which we give is not safe in pregnancy. So we have to see which trimester is it. It's nearer the delivery, or it's the initial stage of the pregnancy. So accordingly, we give those medications. There are separate antifungals which are given in pregnancy.
Okay. So yes, I think for all the viewers, I think this is very important. Something very important we have just discussed, that please do not take whatsoever of fungal infection medicines you are prescribed. Make sure that it is the right thing for the right person. And now we will quickly move ahead. We have already discussed about ringworm, and I think our audience are very much concerned about this. If someone has never had ringworm in their entire life, and he or she wants to prevent themselves, so how can they do that?
Again, coming back to the same thing, keep your skin dry. Don't let the sweat accumulate. If you go for workout or any exercise, make sure that you immediately go and take bath, and don't sit in those sweaty clothes. Avoid dry fit in this weather. Dry fit clothing, you should avoid that. Should wear cotton, loose fitted clothing. And whenever you use the washroom, dry your groin and your fold areas, and then I think it'll be enough for you.
Right, ma'am, right. Now we will move ahead with I can see a lot of questions coming up from the audience. We'll definitely attend them. Ma'am, we have another question coming up for you. How long? I think a lot of people would be concerned with the treatment, because it usually takes time. It takes a lot of patience. So for all the people who are worried about it, normally, how long do we need to take antifungal medicines?
Minimum it's 3 to 4 weeks, but again it depends on the extent of the
Right.
involvement of skin. But 3 to 4 weeks is the minimum time. It might, in some patients, they might have to take it for 2 months also. So it varies from person to person, but minimum is 3 to 4.
Ma'am, at times, is there any chances that we see that fungal infection has been hereditarily transferred from one generation to the other? It's never
No,
possible.
no, it's never possible.
Okay.
It's contagious, like it's skin to skin contamination can happen, but it does not happen like hereditarily. It doesn't happen that.
Right, ma'am. Now moving on to our audience, we have Riya Kapoor asking us, how long does it usually take to recover from a fungal infection, which I think ma'am has just answered, infection with treatment. Yeah, that's it. That's
So
it. That's what she asked.
3 to 4 weeks is the minimum time that you will take to get relief of your symptoms. But might be treatment should be continued for a longer time till the time there are marks left. So you have to treat till then.
Okay. Ma'am, moving aside from the audience questions, what are the initial stages of fungal infection? Suppose someone has recently started having it and he or she is not able to identify it. So what are the normally, what are the initial stages of fungal infection?
So first symptom would be itching. Like when you'll see there'll be itching and redness of that area, and then you might see a scaling and redness sort of a thing in formation of a circular ring. That
Okay.
is how ringworm occurs. But sometimes there is not a typical circular thing. There is a patch of redness, itching, and scaling is there. So that is also fungal infection. If we talk about ringworm, again, white discharge, vaginal discharge is also one thing which is a fungal infection, but that is candidiasis. So that is different. Sometimes in the folds, the skin is macerated. It's reddish and macerated. It's a
Right.
greasy, macerated. So even that is fungal infection. But
Okay.
that's a separate kind of the again the organism differs here. But in broad term, all these are fungal infections. And sometimes patient has no symptom but has whitish or hypopigmented patches on their skin and the underarms. So that is also sort of a fungal infection. But again, organisms differ. So this is how it is that your organisms, everything broadly is a fungal infection, but which is what is when you see and you judge accordingly.
Right. Ma'am, if we are talking about white discharge and vaginal discharge, uh, what what are the rest of the symptoms which you get to see? We have heard about the itchiness, the redness. Uh, do we also see skin peeling and uh, blood occurrence? Does those things
Um,
also?
Blood doesn't happen, but if patient is having excessive itching, there might be scratch marks seen there. Excoriated marks could be there.
Right, right,
And with the vaginal discharge, what happens? Person itches a lot, and whenever they pass urine, then they have that burning sensation. But that happened because you have caused a trauma there by excessive itching. So these are the symptoms patient present with.
normally when such things happen, when fungal infection in such areas happen, we see that the area becomes very warm and it's
Yeah.
really the redness is so much that the area becomes very warm. I have seen people using wet tissues. Is it safe, ma'am?
So that is the most wrong practice people do actually. They say मैं बहुत सफाई रखती हूँ. I wash it every time. They
Yes.
wash it, but they don't dry it. So
Right.
you are providing moisture for fungus to grow. So that is actually making it worse because people tend to, after even the elderly females, they tend to wash their vaginal area after passing urine, but they never dry it out.
Right.
So that increases the infection. So that is one practice that should be discouraged.
Right.
Because that increases the infection. You're
Right.
providing moisture.
Right. Ma'am, for all those people who are working outside, who are very frequently using public toilets, what suggestions can we give for those people who are frequently using public toilets?
So public toilet again depends on, public toilet directly will not cause fungal infection. It might
Mhm.
cause urine infection, but not fungal infection as such. But
Right.
obviously, it's always advisable, carry your disinfectant sprays with you so that you can clean the seat, and you can use those disinfectant wipes, clean that surface before you sit. But again, it comes to the moisture thing. So it's not directly causing that, but obviously you should maintain that hygiene whenever you use a
Right.
public toilet. So that's
Right.
always advisable.
Also, maybe flushing before you use the toilet can be another.
Yeah,
Uh,
that definitely could be, but the entire sheet should be clean. So there are nowadays there are many disinfectant wipes and sprays
mhm.
available in the market. So that
Yes.
should be
Right.
treated by everyone. Okay.
Right, ma'am. Now, moving on to the questions from the audience, we have Aarti Sahu asking us, are there any dietary or lifestyle changes that can support the treatment of fungal infections?
So dietary, I won't say it causes much of a difference, but yes, lifestyle, yes, because an obese person would have more chances of fungal infection because obviously the folds are more deep,
Right,
so that the maceration would be more, the sweat collection would be more. So yeah, if you are working out and you are not obese, the treatment would be better in those patients rather than in an obese patient with multiple folds of skin. So that is how lifestyle could again cause fungal infection.
right. I think with obesity, a lot many, not just fungal infection, there are a
Mhm.
lot many diseases that comes up with that. So it's just your health you're taking care of. Take care of your health, not just worrying for fungal infection, but as a whole.
Everything. Yeah.
Right. Ma'am, we have Kriti Sinha who asked our next question. Kriti Sinha asked, is it necessary for my family members or close contacts to take any precautions to avoid getting the infection from me?
I would suggest that you should wash your clothes separately and nothing specific. Otherwise, you can sit with them, you can share bed with them. That's all fine. Nothing wrong in that. Just, uh, just keep your clothes, your infected clothes, wash it separately. That will be enough. I
Okay. So basically, it does not छूने से कुछ नहीं फैलने वाला है, छूने से कुछ नहीं फैल रहा है यहाँ पे, बस आप अपने hygiene का maintain करें, है ना? Just maintain your hygiene and make sure nobody is using your things and also you are not using anyone's things. That was from Kriti. We have Rohit Kapoor with the next question. What are the potential long-term effects of having recurrent fungal infection?
So the first, which is very common, is hyperpigmentation of that area because of the recurrent infection there. That area can become dark. So that is one. Secondly, in India, which we see, it's actually not because of the fungal infection. It's because of the wrong treatment of fungal infection. Patient uses these steroid creams like betnovate and cordidum a lot. So these can cause stretch marks there. So it's not directly related to fungal infection, but whenever you ask a patient कि कैसे हुआ, they will tell कि हमने tubes लगाई थी fungal infection के लिए, and that is how it happened. So again, you can say stretch marks can happen if you wrongly treat your fungal infection. So these two things, this will cause that change in your skin.
Right. Well, I believe, Rohit, your question has been answered well. We have Manvi Gupta asking the next question. Are there any specific consideration for pregnant or breastfeeding individuals with fungal infections?
Again, the initial precautions remains the same. But again, any pregnant female should not self-medicate themselves, even for the topical medications. If your fungal infection is very limited, also if you have one patch, go and consult your dermatologist. Don't take any random medication from medical stores because that might harm your baby. So you should definitely avoid that. Again, coming to lactation, lactation is still treated like the same as non-pregnant females, but still it needs consideration in the form because again, as we have discussed, there is a postpartum period in which lochia happens. So you're constantly wearing those pads. That can increase the fungal infection. So precaution needs to be taken.
Right, ma'am. Ma'am, with that, we have another question coming up from Kavita. Kavita asks, what are the typical treatment for a fungal infection?
So, so again, it's very tailor-made. It's never
Right.
a one size fit all.
Right.
But antifungals should be is to be used. But again, it depends on the extent, on the site, who has to use that, whether you're diabetic or not. So there are multiple factors which actually on which we decide what medication to be given to.
Right. We believe we have answered this question an ample of time. So I think it depends all on you. It's all about you, and there can not be any answer apart from you visiting your nearest expert. Right, ma'am. Moving ahead, we have Menu Singh asking us the next question. Menu asks, can I still go to school and participate in sports and other activities while treating the infection?
Yes, you definitely can. You just have to wear cotton clothing. You have to take care of your hygiene, and that's it. You can definitely go for your entire physical activity, sports activities, but we continue that.
Right. Ma'am, we have another question coming up from Gitika. Gitika here seems to be very worried. She asks, can I continue using makeup or skincare products during the treatment?
Yes, you can. If that fungal infection is on your face, I would still suggest in that inflammatory stage, you should use less of the products, only the moisturizer and sunscreen. And otherwise, you should avoid that for a particular time period. But if your face is spared, you can do that.
Ma'am, another question is from me. Ma'am, does makeup has any adverse effect on fungal infection, especially on the face area?
See, any kind of a product which is either fragrant, these makeup products are fragrant. So it
Right.
can cause allergy on the area in which skin barriers is ruptured. Because when
Mhm.
you're having a fungal infection, the top layer of your skin is damaged. So when
Right.
you apply any irritant there, or any thick cream, or any emollient, or any fragrant thing, it might irritate that skin. So it's always advisable to limit your products when you have such an infection, because you will
Right.
be definitely applying those topical medications then. So only for the time being you should avoid.
Right.
But
Well,
if it's necessary for some occasion, it's fine. Once in a while,
right.
it's fine.
Right, ma'am. Well, Gitika, I think your question has been answered very well. Uh, Even our doctor in house, and even I would suggest that please, for regular use, let your skin breathe. And if it's very much important to apply makeup, then go with it. I don't think so. It would be even doctor thinks it won't be a huge issue. We have our next question coming up from Gaurav Kamal. Gaurav asks, could the infection spread to other parts of my body?
Yes, definitely. If untreated, and if you're not, if the infection is only supposedly it's only in the groin, but you're not treating it, it will definitely spread to the entire body if you don't treat it.
Right. Uh, we have another question coming up from Maria Said. Maria asks, will having a fungal infection have any long-term effect on my health?
It is just, I would say, physically discomforting if you're having those itching, or 24 hours in a day you're having that itching. So it will just be discomforting for you. Nothing adverse effect in the form of internal health will not happen.
Right. Well, Maria, that was the answer to your question. We have Tina Bhargav with the next question. Tina asks, are there any natural remedies that could help alongside medication?
I would avoid sweating, use normal water for bathing, don't use very hot water. Uh, that's it. I would suggest nothing home remedy would actually treat it.
Right. Well, Tina, I believe just a healthy lifestyle and a hygienic lifestyle would be the natural remedy. And apart from that, please suggest your expert, get a suggestion from her, and use the best medication. All the best to you. We have Sunita Das with the next question. I am 60s, and there are complications or risks associated. Are there any complication or risk associated with fungal infection in older adults?
In older adults, if you're 60 and you're having a widespread infection, you should definitely get your sugar levels checked, because diabetes is very common in India, and people who have uncontrolled sugar tend to have fungal infection. The extent of infection is increased in those patients. Otherwise, for the fungal infection, there's no harm. If you are 60, you have to take the treatment when in whatever age you are. You have to take treatment for that.
Right. Um, well, that was your answer. And now we have Kamal Goswami with the next question. Kamal asks, could this infection be a sign of weakened immunity system?
It could be, but again, it's not only related to immunity, because the people who are very healthy, working out, doing everything possible, still can get fungal infection because it's in your superficial layer of skin, which is actually uh, definitely environment and host. Both causes the disease, but here only the immunity will not help if the environment is not conducive, if you're not doing it enough, and there is always already an infection there. It will not go on its own. You have to take a treatment.
Well, I believe you have got your answer, Kamal. And here we have the last question coming up from Ashok Gupta. Ashok Gupta asks, how can I manage any discomfort or irritation while undergoing treatment?
You have to take treatment. That is how this can be washed for, but definitely again wearing a cotton clothing. If you sweat, change your clothes. Don't sit in those clothes. That will minimize the irritation and itching. And just wear ventilating clothes and be in air conditioned offices. That will prevent that irritation and itching.
Well, ma'am, with that, I think we have, answered almost all the questions, and I believe all our audience have got a clear idea of how to manage fungal infection and how to identify fungal infection. Now, ma'am, before our audience leaves and before we leave, do you have any take-home note for all our audience?
Never neglect your skin. Skin is your largest organ, so you should never neglect because everyone thinks ये थोड़ा सा patch है चला जाएगा. So that should not be the case because वो थोड़ा patch बढ़ जाएगा if you will not treat it on time. And secondly, don't self-medicate yourself because it will harm your skin. It will harm the extent of infection. It will increase, and then by the time you will end up to a specialist, your treatment plan and everything would increase. It will go up till 2 months maybe, which is initially maybe just a thing of 2 weeks. So never avoid that. Always take a treatment from a specialist and don't self-medicate yourself. Avoid
Well,
steroid usage.
right, ma'am. Well, audience, that was Dr. Akshita Anand for us. Thank you so much, Dr. Akshita Anand, for your valuable time. It has been a quite an informative session for our viewers. We look forward for many such sessions in coming times. And viewers, thank you for your excellent participation. For more information and update on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and have a good day.
Thank you.